Hello, my name is Emily, and today I'm going to be showing how to do a neurological assessment. To start, I would close every door. I would make sure that the curtains are pulled, make sure there's privacy for my patient. I'd start by walking in, introduce myself, wash my hands, and then I'd ask the patient to verify who he is to make sure that we have the same patient. I would do that by asking his birthday and his name. So, hi, my name is Emily. I'm going to be your nurse today. Go and wash my hands. Can you tell me your full name and your date of birth?
Colton Selk, 8/12 of 2000.
Perfect. Today we're going to be doing a neurological assessment on you. So we're going to start with your history. Do you have any history of seizures?
No.
Any history of strokes?
Nope.
Any history of meningitis?
No.
Are you on any special diets?
No.
What have you ate in the last 24 hours?
Sandwich, hamburger, fries, and chips.
Okay. The reason I asked that question is because diets high in fats, such as his hamburger was probably fried or grilled and has some grease on it. He's done chips and he's done French fries, which are also fried, can cause clots, and that is one thing that could put him at a risk for strokes, which is a neurological deficiency that he could have. Any drug or alcohol abuse?
Nope.
Any special over-the-counter medicines you use or any herbals that you use?
No.
Okay, perfect. How do you sleep at night?
What do you mean?
Do you get like 8 hours of sleep? Do you get hardly any sleep at all?
About 7.
Any history of sleep apnea?
No.
Any history of tobacco use?
No.
Perfect. How much do you exercise?
Hardly.
Hardly exercise? Okay. How is the stress in your life?
Low.
Low?
Oh, yep.
Good. Perfect. So that is some of the subjective data I would assess from him. Some of the objective data, I would look at him. I would look at how he's dressed. I would look if he's making eye contact or not. I would look at if he's speaking clearly to me. I would look at when he walks in or walks out, which we will also assess later. So the first thing I'm going to do is make sure he's oriented. So can you tell me where you're at?
Pocahontas Hospital.
Can you tell me why you're here?
Neurological exam.
Can you tell me the year?
2021.
And can you tell me your name?
Colton Selk.
Perfect. I would look at his skin and ask him if he's had any rashes lately. Have you had any rashes?
No.
And have you had any neuropathy or numbness and tingling in your hands?
No.
Okay, the next thing I do is I look at his face to make sure it's symmetrical. Some things I can do is PERLA, which is pupils reactive to light, round, and that they're accommodating. So I take my pen light, I go ahead and have him look straight at my eye, and I put the pen light in one eye, and then the other, back to the first one to make sure the opposite eye is constricting, and back to the other. Some other things I would have him do is to look at my finger and just follow it with his eyes, not his head, and make sure that he's seeing everything and that his eyes are moving to where the finger is going. Another thing I would do is to look at like his reflexes and how he moves. So one thing I would do is I put my hand towards his head and have him turn towards my hand, and have you turn the other way. Perfect. You move your head up, down, left, right. Perfect. To assess the cranial nerves, I'd have him do stuff as raise your eyebrows, close your eyes, puff your cheeks up, stick your tongue out. Can you move your eyes up? Move your eyes down. I have him do stuff like shrug his shoulders. Can you stick your tongue out? Stick it back in. Perfect. I'd ask him if he's had any changes in vision.
No.
Any changes in hearing?
No.
Any changes in smell?
No.
Any changes in like touching things?
No.
Perfect. Any dizziness?
No.
Any headaches?
No.
Perfect. Another thing I could ask him was if he's had any history of hypoxia ever in his life.
No.
If you have any cardiovascular issues, such as an irregular heart rate
Nope.
or heartbeat. Do you ever have times where you have paralysis or like numbing and tingling in your hands?
Nope.
What if it gets cold? Do your hands change color at all with anything?
Not really.
Perfect. Okay. Any nausea or vomiting? Any loss of bowel history or bladder
Nope.
function? Okay. Any muscle weakness?
No.
Difficulty walking?
Nope.
Any dizziness or fainting when you get up?
Nope.
Perfect. Any history of MS?
No.
Or muscular sclerosis?
No.
The reason I ask that is because muscular sclerosis is a disorder that causes the myelin sheath to be disconnected from the nerve, and that can affect his nerves and how he moves. Any history of diabetes?
No.
Thyroid issues?
No.
Perfect. Any blood disorders that you have?
No.
Awesome. In my assessment, I could do other things. I could have him raise his arms up. Can you flip him over? And then can you push up against my arms? And then push down. Push outwards. Perfect. You can also have him grab my hands and squeeze to make sure that his grips are equal. I'll have you touch each finger to your hand or to your thumb. Make sure that you can do that. Perfect. Have you touch your nose, and then you're going to touch my finger. Back to your nose. Back to my finger. Nose. Finger. Nose. And finger. And with your opposite hand. Nose. Finger. Nose. Finger. Nose. Finger. Finger. Perfect. To assess his smell, I can have him hold one nostril and then sniff to make sure he can smell this. So I'll have you close one side. And smell. You smell. And close the other side. And smell. Perfect. I can make sure that his wrists are moving. So go up, down, go around, and go the opposite way. Any pain or anything with that? Awesome. Some ways I can assess his gait is have him walking. So the first thing I'll have him do is stand and then walk on his toes and assess any steadiness or unsteadiness of what his gait is. Have him turn and come back. So I'll have you do that. Awesome. The next thing I'll have him do is I'll walk on his heels. So just back on the heels like that. Ask him if he's having any dizziness, pain, any muscle weakness, stuff like that. If he was having a hard time with that or was unsteady, I could put a gait belt on him and walk next to him to make sure he doesn't fall. And then the third test I'll have him do is walk toe to heel, toe to heel, toe to heel, toe to heel, and then turn. Toe to heel, toe to heel, toe to heel, toe to heel. And then I'll have you stand again. So I'm going to perform a Romberg test on him, and that's to test his equilibrium. If you ever have the Romberg test done to you. So what you're going to do is stand with your feet together and your arms at your side, and you're going to close your eyes. And I'll stand with you to make sure you don't fall. So close your eyes. And what I'm assessing for is if he's swaying a lot. Normal people will sway a little just because it's a weird position to be in. But if he's swaying a lot, that means his equilibrium was off. As you can see, he's not swaying at all. Okay. Perfect. I'll have you sit on the bed again, or lay down actually on the bed. And then I'm going to have him take his heel and put it on his shin and run it down his shin. So you put your heel, yep, perfect, and run it down. And back up. And then do the opposite one. Perfect. While he's laying down, I can assess his feet. So I'll have you push against my hands, up towards you, down like you're doing gas pedal. I'll have you go outside and inside, and outside on this one, and inside on this one. Perfect. You can sit up if you want to. So some educational points that I talked to him about is about watching his cholesterol, so having labs done to make sure that his HDLs are higher than his LDLs, and to look at what his triglycerides are like. I could talk to him about exercise, I could talk to him about diet, I could talk to him about hypertension, which is high blood pressure. So for that, so hypertension is high blood pressure. If you have high blood pressure, it can cause you to have a stroke. Strokes will affect your neural abilities. High cholesterol, again, can also cause clots, which again can cause strokes also. I could talk about him not smoking, because smoking can affect your neurological. It can also cause hypertension. I talk about obesity. He's an ideal weight. Otherwise, if he was overweight, we could talk about things like exercising 3 times a day for at least 30 minutes a day. Something as simple as walking. If you had a dog, I'd say, go walk your dog a couple times a week. That'd help. We could talk about diets. Diets, you want to include our diets low in fat, so less fried foods, less fatty foods, and more like vegetables and fruits and stuff to help. And then I could talk to him about how to prevent stuff like strokes, and if he sees a stroke, how to do that. So if you see signs of a stroke, you could do things like look at their face and see if they're symmetrical, ask them to smile or frown, ask them to raise their eyebrows to see if they could do that. You could have them put their arms out, and if one drifts down or the other drifts down, that could show signs that they're having weakness. You could have them talk to a patient and see if they're having slurred speech and anything like that, and then you would ask them the time. So that would be different warning signs of a stroke. That is all I have for now, so thank you for coming in. I appreciate it.